I'm Dr. Hilary Marston, FDA's Chief Medical Officer. I want to share some tips about an important topic, antibiotics. Antibiotics can be like little superheroes, but they don't treat everything. Antibiotics treat a number of different infections that are caused by bacteria, but they don't work on illnesses caused by viruses like the common cold. That's because bacteria and viruses are totally different kinds of germs. So talk to your healthcare professional about the best treatment when you're sick. Your provider can help figure out if antibiotics will help at all, and they may also run tests to see which type of antibiotic will work best. Here's an example. They can test your urine to see what kind of bacteria is causing a urinary tract infection, and then they can prescribe a specific type of antibiotic that works best for that kind of bacteria. It's important to know what's making you sick so you can get the right treatment. And it's also important to use the correct type of antibiotic for the correct amount of time. Using antibiotics incorrectly can help contribute to the growing problem of antibiotic resistance. Sometimes bacteria develop defenses or resistance against antibiotics when you don't take them for long enough, or if you take antibiotics when you don't need them. When bacteria develop resistance against antibiotics, it's harder and sometimes impossible to treat that bacterial infection. When antibiotics no longer work against certain types of bacteria, some people may have longer or more complicated illnesses, more medical appointments and hospital stays, and some people will die from bacterial infections. By using antibiotics correctly, you can help ensure that these life-saving drugs will work when you and your loved ones need them most. If you're prescribed antibiotics, take them as directed, even if you start to feel better. And for antibiotics to help you get well, remember these tips. Take them exactly as prescribed. Don't skip doses. Don't save some of the doses for the next time you get sick. And don't take antibiotics that are prescribed for somebody else. Talk to your healthcare professional about all of the medications you're taking to lower the chance of a drug interaction or serious side effects. And talk to your provider or pharmacist if you have questions about your antibiotics or if you have any unusual symptoms or side effects while taking the medication. Check out our website for more information on this and other ways to stay healthy.